I'm Dennis Anderson along with Pamela Fish, and here's what's coming up on Almanac North.
Heroin and other opioid addicts will soon have a new option to help them kick their habit. Officials say the rise in drug abuse is a public health epidemic.
We'll tell you about new treatments available for those who suffer from epilepsy and how you can help raise dollars and awareness.
And we'll have a news file story from 25 years ago and the latest business headlines.
So don't go away. Almanac North is next. Hello and welcome to Almanac North. Thank you very much for watching. Pamela Fish filling in this week for Julie. Good to see you, Pam.
Thanks, Denny. It's always nice to be here.
All right, let's get to our first topic.
Okay, let's. Duluth Center for Alcohol and Drug Treatment will soon open a new clinic for those addicted to heroin and other opioids. ClearPath Clinic will focus on medically assisted treatment options to help its clients become drug-free. Slated to open later this month, ClearPath will be able to treat about 400 patients when services ramp up to full capacity. Here to tell us more is Gary Olson, the CEO of the Center for Alcohol and Drug Treatment, and Mark Nelson is the Director of Adult Services for St. Louis County Public Health and Human Services. Thanks for being here. I appreciate it.
Thank you.
Gary, I want to start with you. It seems as though your clinic is opening just in time since the local methadone treatment center is about to close.
Yeah, this has been about 3 years in development, and there's a lot of regulatory hurdles to overcome. And we became aware only in the middle of June that DHS and the owner of the existing clinic had reached an agreement to close that clinic on September 1st. And we're tasked with transferring those patients to ClearPath in between July 21st and August 31st.
You bring up a good point, Gary. There have been some issues with such clinics in the past. How is this different?
Well, I think the main difference, most of the clinics in Minnesota are actually for-profit or run by for-profit companies. And I think the difference is we're developing a clinic that's embedded in a continuum of care or a recovery-oriented system of care, because the center offers outpatient treatment, residential treatment, traditional treatment options. So the clinic is going to be part of that continuum and integrated in a way that most of the clinics aren't. They've been operating more or less in isolation. So that's one of the biggest differences. The other is the connection with the community that the center has developed over since 1961, so the ability to integrate with and collaborate in the community. Right.
Mark, part of the reason this is so timely is because of the huge increase in the abuse of prescription drugs and hard drugs in just the last few years. Do we know why that's been happening?
Well, it's pretty well documented now. It was not much discussed for some time, but the history has really, or the epidemic really that people talk of now with opioid drugs is related to the overprescription of opioids and pain medication. And it's not a local issue, it's a nationwide issue, and it's something that the healthcare community is doing something about now. We have a community group called Opioid Abuse Response Strategies Work Group in the region now. And one of the big partners with that is Essentia Health, and they are changing their prescribing practices, and their leadership is addressing it, just as an example. But that's a significant contributing factor.
So, Mark, how's the county involved?
St. Louis County has been involved for a long time with substance abuse, but on this particular issue as it relates to the medication-assisted therapy clinic, in Minnesota, the statutes allow for the state to make a decision on who will provide the service that we're talking about tonight. and it is, but it also gives permission to counties to weigh in on it.
I see.
And so back in 2012, when we as a county and the communities in the region and Fond du Lac Tribe as well, about the services that were available under medication-assisted therapy, we had talked to, and there was a second provider that had received authorization by the state to open another clinic, but the development was such that it was really in isolation from the rest of the community, the healthcare community, public health and human services, the treatment community. And so we asked Commissioner Jessen to allow us as a county to be part of the development. And so that was the beginning of so they reversed their decision on the second clinic, the state did, and allowed the county to issue a request for a proposal in late 2012, and there were 6 providers that responded to that from the county, and then the Center on Alcohol and Drug Treatment was issued that letter of need, allowing them to go forward with the development.
Right, and here we are. But Gary, explain to us what that is, medication-assisted therapy treatment. Just define that for us.
Well, I think the big picture is that for a long time, we have not been integrated with the medical system, even though addiction is really considered a disease and is part of the healthcare system. It's a public health problem, but there have been medicines developed over many years that are helpful in treating addiction, but they have not been used very widely. The exception is with opioids. Methadone was developed in the 1960s, or started being used in the 1960s to help with heroin epidemic of the 1960s, and it's an opioid replacement drug. So what it really does is it normalizes the brain. So people that are in kind of the vicious cycle of addiction, their brain functions in an abnormal way. So they're the medication, the purpose of the medication, like with other medications, is to really normalize the brain function. But it only does that. It doesn't really treat the addiction. So that's where the other part of the treatment, the psychosocial treatment, the counseling, the therapy come in. So that's the main function of the medication.
And there could be people watching this program tonight, Gary, who need help. What would you say to them?
Well, I think what we're offering is a pathway, and it's why we named our clinic ClearPath, because we're offering people a pathway and a support to go from a struggle with opioid painkillers or heroin or whatever that opioid type drug is that they're struggling with, to stabilize and to get their life back. And ultimately for many of the people it will be a drug-free life. But the pathway is a long pathway. It doesn't happen quickly, and it's actually true with all addiction. The recovery is a long-term process. It's not something that happens quickly. This is just the only difference here is that medication will help people make that move toward that healther life.
And to be clear, it's not just methadone, because there have been some issues with methadone.
Right, that's right. Yeah, there are newer drugs. The one that we'll be using, and this is not used widely in other clinics because it's expensive, is called Suboxone, and that's a compounded medication that includes what's called an opioid antagonist. So it's safer drug, and the evidence indicates it's a little easier for people eventually to get off of than methadone. So we will be offering Suboxone to patients or methadone, whichever is appropriate, and that determination is made following a really thorough analysis of the situation by the physicians and our clinical team to determine what's appropriate.
It's called an epidemic. Just saying no apparently hasn't worked. How do we fight it?
Well, I've been with the opioid abuse strategies work group, and what we talk about a lot is that we need parallel strategies. The clinic is not going to solve the problem. So we need prevention, we need treatment, we need recovery support, we need law enforcement, and we need clinics like we're opening. So this is just one piece of a strategy, and I think in our region we collaborate in a way that most other areas of the country just don't do. So I think we have the ability to pull this off.
Mark, is the county involved in prevention strategies?
We are. In 2014 and 2015, the St. Louis County Board identified some prevention monies to hire to fill. We have 3 social workers that are doing community prevention work, and as an example, there's a process called screening. SBIRT is what it stands for: screening, brief intervention, and referral to treatment. And it's a way of training professionals not to do a full-blown assessment, but to engage people in the possibility that they have a substance abuse problem that would lead to some other steps. And so our staff have provided training for a lot of healthcare professionals. We're also active in the court system now. And so it's equipping other professionals that encounter people that are challenged, and so that's just one of the things. But getting in the school systems, we've had a number of town hall meetings. We partner with the Duluth Drug Task Force.
So education is a big part
just
of it.
awareness, and just looking at those spots where people, you know, the gateway situations, and painkillers has been one of them.
Is treatment typically covered by insurance?
Yes, it is.
It is.
In fact, Paul Wallstone was instrumental in the federal parity law. So mental illness and mental health and substance abuse have to be treated like all other illnesses. So insurance plans are required to treat that like they do other illnesses. So yes, insurance does cover that.
With regard to heroin and opioids, is there a certain population that's more likely to become addicted to these drugs?
You know, you would think so, but really it's, I just was reading some statistics that the heroin use increased most quickly in households with over $50,000 annual income and amongst women. And I looked at the statistics from the existing clinic, and half the patients there are women, and that's very unusual. So it's not confined to any particular group. We've gotten to know some of the patients from the clinic, and they come from every walk of life, every background. So, you know, susceptibility has more to do with genetic vulnerability than it does your income or your race or your socioeconomic status or anything else.
So ClearPath is opening later this month. Did you say 21st?
July 21st is our target date.
What kind of hours will you keep?
We will be open 7 days a week, which is unusual for a clinic. Most of them are open 6 days a week. We have hours from very, very early morning to about midday every day. And then there will be groups, of course, therapy groups that will run at other times. So the clinic itself, the medication part of it will be open from, I think it's 6 o'clock in the morning or 5 o'clock in the morning till noon, and some different hours on the weekend, but 7 days a week,
Okay. All right. Well, great. I'm sure that you're looking forward to it, as well as the county and others in the region, to offer a lot more help.
Thank you for sharing your story.
We appreciate you being here tonight. Thanks much.
Now, let's dig into our news file archive for a look at what was making news 25 years ago this week.
It looked like a replay of the 4th of July, spectators lining the railroad tracks by the waterfront just waiting for the boom. In the meantime, these 2 harbor residents were getting their last look at these 2 old coal bins that have been a landmark ever since most of them can remember.
I grew up, my graduating class was the first one to climb up and put class of '64 up there. Was not looked kindly upon, but I mean, it's kind of sad.
I've heard a lot of people are against it. I personally don't have opinion either way, but a lot of people use it as a landmark when they're out fishing, and they're going to lose a landmark.
Whether or not to destroy these coal bins has been a controversy in the town. Some think they're a landmark, others an eyesore.
I think they're ugly too, but I sense that there was a lot of feeling by old railroaders.
I don't think this is much of a landmark. It really doesn't, to me, it doesn't tell me too much. As I mentioned before, you've got 2 tanks. The rest of the superstructure is all gone. And I use the illustration, it's like having the cup and the coffee pot's gone.
After years of discussion, the city council finally decided to bring the bins down. And after hours of delay, down they came. The old coal bins are now just rubble. Their historical significance is gone, but the view of Lake Superior has been enhanced. For Late Edition with photographer Dave Stokes, Stacy Scheibel, KDLH News.
You may not realize it, but about 1 in 10 people will suffer a seizure in their lifetime. The Epilepsy Foundation of Minnesota is leading the fight to stop seizures, educate the public, and help overcome the challenges of epilepsy. Now, there are many treatments that can be successful, and now medical cannabis is an option for some forms of epilepsy with its legalization in Minnesota. Joining us with more is Lisa Peterson, Northern Coordinator for the Epilepsy Foundation of Minnesota. Lisa, thanks for being here. You have a personal story in your lifelong journey with epilepsy. Can you share that a little bit?
Sure, I would be glad to. So as you alluded to, I have a connection to epilepsy. I had epilepsy as an infant. It started, my first seizure lasted over 2.5 hours, and at that time I was put on medication. And my parents were optimistic that I outgrew epilepsy when I was 5, and I stopped having convulsive seizures, and for the next 11 years, no one knew that I had epilepsy. And so in 1996, I was finally diagnosed again when I had a seizure while driving, and thankfully it ended up being a situation where I was safe, and I was tested that day, and I was identified as having epilepsy again.
Eventually you had surgery.
I did, yeah. After I failed 2 drugs, I knew that I was a potential candidate for brain surgery, and so I opted to pursue that option, and it ended up working for me. I had brain surgery 13 years ago. And 10 years ago this month, I fully weaned off of my medication, and I've been seizure-free ever since.
Wonderful.
Congratulations.
Wonderful.
But you were born with epilepsy, is that correct?
You know, we don't know if they started right at birth, but essentially, yeah, mine were caused from an abnormality.
Okay.
And so seizures can be caused from a variety of reasons. For me, it was an abnormality with my brain development. For some people, it's head trauma. It could be a stroke. It could be a tumor. And actually 70% of the cases, we don't know why someone has epilepsy. We just know that they have it.
So it doesn't always start at a real young age. You are, what, a year and a half old or less?
Yeah, just a little over a year. It can happen to anyone at any age without any forewarning. And a lot of times, in situations such as mine, people won't always recognize that that person has epilepsy right away. Most people, when they hear the word epilepsy, they think of someone falling to the ground and convulsing.
Right.
That's actually not the most common seizure type, and we call that type of seizure generalized tonic-clonic. Generalized means the whole brain. The tonic stage is when everything tightens up, and the clonic stage is the shaking. So that's what people will generally tell you they think a seizure is. It's more often much more subtle. Seizures can come from part of the brain instead, and during a simple partial seizure, it could be sensory only, so it might distort their sense of smell. It might be a metallic taste in their mouth. It might be a ringing sound in their ears, often described as an intense feeling of fear and anxiety. Deja vu, so someone might report it as that funny feeling, and on the outside you don't see it, or it could have some visible shaking, but not always. And if it does happen to be a precursor before a bigger seizure, then you maybe can put the 2 and 2 together, but someone can go a long time with that type of seizure without knowing it, or it can be a complex partial seizure where somebody would have an altered sense of awareness. Again, part of their brain is having the seizure, and it causes them to maybe do some picking. It might cause them to wring their hands, blink excessively. They won't know that they're doing this. They appear to be awake because...
But they are actually having a seizure.
They're actually having a seizure, so they won't remember that length of time that it was happening. They might say or do things that don't make sense. I started having that type of seizure as a teenager, and so all those years that no one knew I was having seizures, I called it the chills because I didn't know what that funny feeling was.
Wow.
Now people could see it. And so that's sometimes what it takes is a parent, a teacher, somebody who's aware of what those seizures look like or start to catch on. It might even look like a blank stare. An absent seizure can be mistaken as ADD in students because they might just momentarily blank out and then they're right back with you.
So it's a challenge to diagnose?
It's very challenging, yeah.
But there are many treatments.
Definitely, and so what happens is once it's suspected that someone might have epilepsy, they probably will have their regular doctor refer them on to neurology. a neurologist would refer them for testing. An EEG, they put electrodes on that individual's head, and those can actually detect abnormal brain activity. They might use an MRI or a PET scan, and then if they do decide that that person does have epilepsy, then they can look at what treatment options are best for that individual. Medication is the first line of treatment, and it helps a lot of people, but 25% of people with epilepsy don't respond to medication. So if you fail 2 or 3 drugs, you most likely will fail all the others. There's actually a long list of medications, and we provide information for individuals about the possible side effects, and they can talk to their doctor about which medication might be the best choice for them, but they might be left wondering what else is there if maybe medication isn't working. And so there's a specialized diet. It's called a ketogenic diet. It's high in fat and low in carbs. That works for some individuals.
And there's a new medication now that a lot of people are talking about because it was just legalized. Can you tell us about the use of medical marijuana?
Yeah, medical cannabis is now available. And if people do have questions, we definitely encourage them to talk to their doctor. We have information right on our website that will direct people to some of those resources that they might be looking for. We have a 1-800 number. We have a link to resources about cannabis. There's a page that will help patients know the steps for how to even start the process of finding out if that might be a viable option for them, how to talk to their doctor, how to get registered. And we have information for medical providers as well in what steps they need to take to even become qualified.
There are a couple events coming up. When are they? What should we know about them?
So some of the events that we have coming up are the Midwest Seizure Smart Conference. We're so excited. It's less than a week away now, next Thursday, and it's at the Radisson in Duluth, and the event starts at 9 a.m. and it runs until 4 p.m. and we will have 5 CEUs available, and it includes breakfast and lunch. It's free for people with epilepsy, and it's $40 for anyone else. Also, we will waive the fee for parents, so if we have individuals who maybe want to attend it and they have kids with epilepsy, we encourage them to do that. The agenda is available online with all the information about our keynote speaker, our sessions that they can attend. And so if anyone's interested, they can check out our website and find out all the details. They can register online, or they can call our 1-800 number.
Lisa, what would you like the general public to know? What should people know about epilepsy? I know there's a lot to know, but if you just had a key thing, what would you like the general public to know?
I think the things that we really hope people will know is that it's nothing to be afraid of. A lot of times people fear it because they just don't know. And so what the Epilepsy Foundation in Minnesota does is we educate, we empower, and we connect people affected by epilepsy. We want to break the stigma. There's a lot of wrong thinking that still exists about epilepsy today, and we want people to understand that it's not mental illness, it's not demon possession. People still have some outdated ideas about what epilepsy is, and so there's a lot of fear sometimes that people have of what will people think if I tell them I have epilepsy. Again, anyone can have epilepsy, and we want to help people understand that you can't see it by looking at that person.
Is there some education going on in schools now? Younger people should know this.
Definitely. We provide free seizure recognition and response training to any group. So if anyone from caregivers to school personnel, bus drivers, first responders, nurses, social workers, anyone, community organizations, we're glad to provide that training. So our state is broken into 5 sections, and eastern North Dakota. I cover 11 counties, and so I am glad to assist anyone in northeastern Minnesota on providing that training. And we love to make schools seizure smart, schools, classrooms, and districts. And so it's a very big initiative that we have.
That's wonderful.
Okay, great.
Well, we want to thank you very much, Lisa.
Yes,
we certainly hope that your upcoming events are successful.
And we do have the Rise Above Seizures Walk on August 1st, so we hope
wonderful.
individuals will join us
for
that as well. It's a great way to connect with others.
And that's for anybody to get involved in.
It is, yeah. Last year we had over 400 people at our event here in Duluth. And
where does it begin?
It's at Denfeld, and August 1st is a Saturday. Check-in is at 9. The event, the walk begins at 10. And anyone can form a team, friends, coworkers, family members. We hope people will join us and help raise funds and awareness for epilepsy.
Thanks for telling us your story. Lisa Peterson, Epilepsy Foundation, thank you.
Thank you so much. Thanks for coming. It's time now for the week's business news from the editors of Business North. The Leibovitz School of Business and Economics at UMD has established a financial planning major with classes beginning this fall. There's a significant need for more financial planners as a wave of baby boomers retire. According to the new program director, 43% of current advisors are age 55 or over. In fact, there are more professionals over age 70 than under 30.
The Entrepreneur Fund's Women's Business Alliance has received a $250,000 award to promote the retention and expansion of female-owned businesses in Minnesota. In addition to providing customized programs for female business owners, the money will fund efforts to access new markets and expand market share. Other services offered by the Women's Business Alliance and Entrepreneur Fund include business reviews, strategic planning, and financing. A portion of the grant will be shared with the Arrowhead Economic Opportunity Agency.
Two companies have teamed up to build bike trails in Duluth. Outdoor furniture maker Lowell Designs is working with Bent Paddle Brewing to create a new beer. And 5% of all sales will help the cyclists of Gitche-Gumee Shores reach its goal of building the Duluth Traverse. It would be the first 100-mile system of single-track trails within an urban environment. Both companies are longtime supporters of bike trails, which are expected to bring a new wave of tourists to Duluth. For more on these and other stories, please visit businessnorth.com.
If you have a comment on this week's show, call now, dial 218-788-2849 to leave a message, or send an email to almanacnorth@wdsc.org, and check out the WDSC website to get updates on PBS programs, learn about upcoming station events, or to support the station with a donation. Pam, always great to work with you. Thanks for hosting the program with me tonight.
Nice to see you as always, sir.
All right, thank you. For Pam and the crew at Almanac North, I'm Dennis Henderson. Have a great weekend. Good night, everybody, and be kind.